Okay, this horse then is a 14-year-old gelding. I'm going to do some demonstration on different kind of treatments on this horse. And very common problem of horses is leg issues. And what we start with is a digital flexor tendinopathy, sorry. And very common with this problem is that they get limp, the horses, when they get the issue. And the reasons for getting limp is very often an overload. Too heavy training, too heavy action, and that makes them sore, and they will swallow up. Very often we see this problem sitting in the lower part on the leg, at least on those breeds, but sometimes also up in the tendon area. But in the lower part it can sit on the medial branch or the lateral branch, because those two splits on by the fetlock. So I'm going to demonstrate now treatment for the lateral branch, which I also treat a part of the tendon. Very sinful here and very useful here is to get a veterinarian to do an ultrasound check before you start treating. Then you know exactly the location of the bleeding in the tendon and where the rupture fibers are. So my suggestion is, if possible, get an ultrasound scanning from the veterinarian, or if you are a veterinarian, do ultrasound scanning before starting treatment. The prognosis by the treatment is pretty good, and we've done several horses with this problem, and we see that we decrease the rehabilitation time, sometimes even with 50-60%. Normally, in common saying, the veterinarian says it will take you 5 to 6 months to get the horse back in full shape for training again. We've seen several horses being back in training like for 2.5 to 3 months after the injury. Of course, in the training you have to have a decrease of action of the horse. You cannot start on the top level again, but like a normal rehabilitation of any sportsman, you build it step by step to get them back in the show fit. So I'm going to demonstrate this treatment and also demonstrate how to use this Skanlab vet, and where you put the return electrode, and where you also use the treatment head. Because on the machine you have the parameters already fixed on the machine. So you just pinch the button, digital flexor tendinopathy, and say OK, and then we get already the dosage and also the treatment time. And as soon as we are ready, we start this up. But first, before you do that, you have to make some preparations on the horse. You have to prepare it for treatment, placing the return electrode and so on. So we start with that now. Okay, by treating the horse leg, we can still place the return electrode on the back, because it's very easy to put it there and it's out of the way when you sit working, and you're not in the way with the legs on the horse. But first, before we place it there, we have to water the coat on the fur, because to get good connection. So we wetten it, hopefully with some warm water. The horse accepts that a little bit better than the cold water. Just moisten it and wetten it enough, and after that we're gonna add some conductive cream to get the optimal connection. So we use this Skanlab cream or Vet cream, because it's made for this machine and this kind of treatment, and so we get the optimal electric field through the horse to be able to get the treatment going on the leg. So I add enough cream, massage it down a little bit in the coat, and after doing that we're going to go down to the leg and prepare the leg as well before we attach the electrode. Then we have to prepare the leg, which we are going to treat. Also there we use a wet sponge to wetten the coat and to get the air out of the coat and get the optimal connection. After that we have to put some cream here on as well to get the optimal effect and get the electrostatic field into the tissue. So now is the back and the leg prepared. Now we're going to put some cream here, and then we're going to attach the return electrode on the back and start the treatment. And like I said, I'm going to focus on the lateral branch of the deep flexor tendon, which could be affected by a tendinopathy. But still, I can't only treat just on the branch. I have to follow the tendon to increase the circulation and the metabolic activity to get a reflow and pull away the metabolites that could be attached in the area after the injury. Okay, then attaching the return electrode, we use a rubber band and put it around the body of the horse in the moist. And then we have this knot, which make it easy to tighten the band to get optimal connection. And I put the knot where I'm expecting to have the return electrode, because that gives some extra pressure on the return electrode if it's underneath the knot. Just have to find the band here behind. This is almost like pulling the saddle. He was a little bit thicker than I thought, so we just have to move this. And that's the easy why we have so many holes. We can move this around a lot and use it wherever it's needed. Then we should be good. And I tighten it firm, but not like he's stopped breathing. And I can tighten it even a little bit more. And I do that after putting the return electrode underneath. Then I have put the electrode underneath the rubber band, and I also put the cable just underneath the band. Then it won't be moving around. If the horse moves around, it won't pull the electrode away or something like that. So that's a kind of security for having it underneath there and keep it staying there. Just be sure that you get it proper underneath the knot. Then we have prepared the horse and are ready to start the treatment. I have the treatment head here, and I start with the on and off bottom. And its lights goes on when it's on, and we are ready to go. Moving firmly, firm contact but no big pressure. Just in circles, working the area. And sometimes the horse might react a little bit, but don't worry, they will soon accept and figure out that this is really comfortable, and it really gets them the feeling that you try to help them. So like you see, I'm working down on the bottom of the lateral branch, and I also work a part of the tendon further up to increase the metabolic activity and the little circulation we have in the capillaries in the area to stimulate the area to get more vasculated and also metabolic activity. This will get rid of the metabolites and also speed up the regeneration process due to increased amount of oxygen coming to the area with the circulation and also the metabolic activity. If the horse starts moving back and forth and feeling uncomfortable, the first thing you try to do is go one step down on the treatment head, minus, and continue, see if that's okay. And you can also check yourself by putting your finger on the tissue and feel, is it really hot or is it comfortable warm? It shouldn't be really hot, it should be comfortable warm. Sometimes I also check myself with the head here, but then out of the electric circuit, so I won't feel too much. So the best thing of checking it is like putting your finger against the tissue where you've been treating. If this was a subacute tendinopathy of the digital flexor tendon, I should be treating him like every day for the 5 to 6 first day, and then second week 2 or 3 every second day, third week every third day, and after somewhere between 12 to 16 treatments you should have been doing the best that you need to do for this problem. And of course, if possible, check it with the ultrasound scanning with the veterinarian to check how the progress is becoming, how is it going. Then, as you maybe not see too much now, but the horse is really relaxing. He's dropping his lip, feeling comfortable. He's really, maybe we can make a zoom on his head and see how he's kind of dropping his head and relaxing. And you can see his underlip is hanging a little bit, and he's saying, oh, this is really nice. So this is the normal reaction you get of a horse. This horse knows the drill. He has had this problem before and has had in this treatment, so he knows that I only mean to help him and make things better. The treatment time of this issue is like 8 minutes of this problem, depending on, but you have the set protocol in the machine, so you don't have to worry about figuring out how much you must be treating. Sometimes, like you see, the horse moves his legs, but that can only be a question of rebalancing themselves. And if it's no problem, we try to continue with the same intensity. If the horse starts moving back and forth a lot, then we decrease the energy level once more. And that is the treatment. Now we're going to see what are we doing afterwards the treatment. Okay, after finished treatment, we come back with the nice and good warm water again. Get rid of the most of the cream, because legs that are white have a non-pigmentation in the skin underneath. That skin can be a little bit more sensible for if you let too much cream stick there for a long time, that you don't clean them good. I don't mean you're gonna shave them or like clean them, but just water it enough to get rid of the most of the cream, and after that you take a towel or paper to just dry it good. Make some friction and just dry the area where you had the cream and also where you would treat. Of course, if the tendon is very sore, be a little bit firm doing this, because it can be painful in the first 2-3 times. And not too much to worry about, actually. Okay, we have to do the same process on the back, where we have the return electrode, and just use some water, get rid of the cream, and dry it up as good as possible.